The journey of childbirth is a miraculous experience, but it doesn't end with delivery. Welcome to the world of normal puerperium, the postpartum period lasting around 6 weeks, where a woman's body undergoes remarkable changes as it returns to its pre-pregnancy state. First few hours after delivery is known as immediate postnatal period, during which the mother recovers from the strain of the labor. Postpartum chills occur during this time in 25 to 50%, which is self-limiting and can be covered with blanket if necessary. During this time, the reproductive, endocrine, and cardiovascular systems go through significant transformations. The uterus undergoes involution, gradually shrinking back to its pre-pregnancy size and weight. This process is aided by contractions of the uterine muscle and the shedding of the decidua from the uterine lining. The cervix, which was dilated to 10 cm, remains 2 to 3 centimeters dilated for few days and then gradually contracts and thickens. The external oors, which is round in nulliparous woman, becomes a transverse slit in multipara. Changes in glands, edema, etc. begins to regress and is complete by 6 weeks. Women may notice lochia, a vaginal discharge consisting of blood, mucus, and uterine tissue. Initially red, known as lochia rubra, it gradually decreases in 4 to 5 days. Following 2 to 3 weeks, pale, thinner discharge known as lochia serosa, and later changes color to yellowish-white leukocyte containing discharge known as lochia alba. Intermittent contractions of uterus give rise to afterpains, which may be pronounced during suckling due to oxytocin release. More common in multiparas, usually subsides within a week. Vaginal wall contracts and rugae gradually reappear in the puerperium. The vascularity decreases. Following vaginal delivery, there's edema and submucosal hemorrhage in the bladder, increased bladder capacity, and mild reduction in bladder sensations. These lead to stasis if urine, incomplete voiding, epidural anesthesia, and reflex urethral spasm due to pain at episiotomy or perineal tear can worsen symptoms. Stress incontinence can occur following prolonged labor or instrumental delivery. Hormonal changes play a vital role during puerperium. Prolactin levels remain elevated and estrogen levels remains low till 6 weeks, leading to changes in breast size and milk production during breastfeeding. There is suppression of pulsatile release of GnRH normalize after 2 to 3 weeks in non-lactating women. FSH levels are normal, but the ovary remains unresponsive to FSH. This formed the basis of ovulation suppression and amenorrhea. In non-lactating women, ovulation can begin after 75 days of delivery, and the duration is about 6 months in lactating women. Postpartum thyroiditis occurs in 10%, which is autoimmune and largely asymptomatic. In the cardiovascular system, blood volume, which increases during pregnancy, gradually returns to pre-pregnancy levels. Initially, cardiac output decreases, but eventually returns to normal. Blood pressure typically stabilizes within the first week postpartum. After delivery, mother and baby should be closely monitored in labor room for 2 hours. Subsequent care should be taken, which includes early ambulation of mother within few hours after vaginal delivery and 6 hours following cesarean section. Important to facilitate bowel movement and reduce the risk of venous thrombosis. Mother and child can be discharged 48 hours after vaginal delivery and 72 hours after cesarean section. There is high chances of urinary retention after delivery. Therefore, women should be encouraged to void soon after delivery. If bladder is distended and the woman doesn't void in 6 to 8 hours, a single catheterization is performed. If she still can't void her own, an indwelling catheter should be introduced and left in place for 24 hours. Plenty of fluids, a high residue diet, and, if required, mild laxatives are recommended in case of constipation. Symptomatic hemorrhoids are frequently seen in postpartum women. Supportive treatment with sitz baths, analgesics, stool softeners, high-fiber diet are recommended. Breastfeeding should begin within 1 hour of delivery. Rooming in and skin-to-skin contact are essential. Nulliparous women should be instructed about proper breastfeeding technique and hygiene.